Hi, my name is Gabriel peñafiel. I will talk about electrolyte and acid-based disturbance in patients with diabetes mellitus. Electrolyte disturbance. Electrolyte disturbances are common in patients with diabetes and may be the result of an altered distribution of electrolytes related to hyperglycemia induced in osmotic fluid shift of a total body deficit brought about osmotic diuresis. Electrolyte disorders are most often caused by loss of bodily fluids through prolonged vomiting, diarrhea, or sweating. They may also develop to the fluids loss related to burns. Certain medication can cause electrolyte disorder as well.
Diabetes is a disease in which your blood glucose, or blood sugar, levels are too high. Glucose comes from the foods you eat. Insulin is a hormone that helps the glucose get into your cells to give them energy. With type 1 diabetes, your body does not make insulin. With type 2 diabetes, the more common type, your body does not make or use insulin well. Without enough insulin, the glucose stays in your blood. Glucose comes from the foods you eat.
Over time, having too much glucose in your blood can cause serious problems. It can damage your eyes, kidneys, and nerves. Diabetes can also cause heart disease, stroke, and even the need to remove a limb. Pregnant women can also get diabetes, called gestational diabetes.
A blood test can show if you have diabetes. Exercise, weight control, and sticking to your meal plan can help control your diabetes. You should also monitor your glucose level and take medicine if prescribed.
Application in medicine. In diabetes, glucose stays elevated outside of the cell, resulting in starved cells despite high glucose levels in plasma. Cells switch to protein and fatty acid catabolism, which can result in increased urea and ketones. When glucose levels stay high in the plasma, it can cause osmotic damage to nerves, resulting in peripheral neuropathies, reduced wound healing. Increased inflammation through reactions that create oxidative stress and inflammation are modified to become advanced glycation products, which promote both microvascular and macrovascular complications. Potassium. Any increase in plasma or serum potassium resulting from in vivo hemolysis is through hyperkalemia. By contrast, in vitro hemolysis is a process that can occur in blood removed from the body and is due to the mechanical disruption of erythrocytes induced by the process of blood collection and handling.
When food is ingested, it travels along the digestive tract, where it is broken down into its component nutrients in order to be absorbed into the bloodstream. One such nutrient is glucose, a simple sugar. Glucose gets absorbed by the stomach and intestines, and then enters the bloodstream. It travels through the circulation to all body cells. Once absorbed into the bloodstream, glucose circulates, causing the blood sugar level to rise. An increased level of blood sugar sends a signal to the pancreatic beta cells, which respond by secreting the hormone insulin into the circulation. Insulin is necessary for glucose to reach and be used by several important target tissues throughout the body. These include the liver, muscle, and adipose tissue. Insulin is necessary to keep blood glucose levels stable in the body. glucose enters the cell through a process called facilitated diffusion.
Acid-base disturbance. Diabetic ketoacidosis is a life-threatening problem that affects people with diabetes. It occurs when the body starts breaking down fat at a rate that is too much fat. The liver processes the fat into a fuel called ketones, which cause the blood to become acidic. Pros and cons. Pros. The treatment of diabetic and ketoacidosis involves in administration of insulin and intravenous fluids to correct the depletion. The primary goal of therapy of hyperkalemia, acidosis tubular renal, is to correct the hyperkalemia. In many instances, reducing plasma potassium concentration will correct the acidosis. Con. Hyperkalemia is frequently present of admissions in patients with diabetic ketoacidosis, even though the body potassium is reduced.
What actually acid is introduced into the body? Well, buffers take care of it. What are buffers? Buffers act like sponges, taking up hydrogen ions when there's too much of them and releasing them when there's too little. The primary buffers in the body are bicarbonate, or HCO3-, hemoglobin, phosphate, and bone. 60% of buffering happens intracellularly, and 40% happens extracellularly. The primary buffer in the extracellular compartment is bicarbonate. Let's see what happens when acid is added into the body. Let's talk about metabolic acidosis. So in metabolic acidosis, there's an excess of hydrogen ions. What happens to these hydrogen ions? They combine with bicarbonate in order to form carbonic acid. So as hydrogen ions increase, bicarbonate decreases. And what happens to carbonic acid? Well, that dissociates into water and carbon dioxide. And what happens to carbon dioxide? Well, carbon dioxide, as you might already know, is then eliminated and exhaled through the lungs. We can adjust carbon dioxide elimination through hyper and hypoventilation.
Applies in Ecuador. Since the high prevalence of diabetes ensures the clinical in virtually every medical specialty we interact with these patients, familiarity with related electrolyte abnormalities is important.
It's also called insensible losses. Happens big time with patients with heat exhaustion, fever from sepsis, or a process called diaphoresis, also known as profuse sweat. Basically, big stoma drainage, like with a colostomy, will drain your electrolytes very, very quickly. Peeing or urinating, or basically your urinary tract, from your kidneys, or fancy words for renals and nephrons, down to your bladder and out your urine. Because, guys, the electrolytes are in the blood, and the blood is filtered by the kidneys, also called the washer machines of the body, that wash your blood kind of like a little car wash for your blood cells. Lastly, we have sweating, like when in the gym or running to class or right before your last nursing exam. Wait. You ever cover this in class? Sodium, also called salt, comes out during the sweating process. It's also called insensible losses. This happens with heat exhaustion, fever from sepsis, or a process called diaphoresis. Basically, big time serious stuff. Lastly, a little side note, even burn patients lose a lot of fluid and electrolytes together in the same kind of process of fluid. So the big takeaway point here to wrap all this up is to remember the electrolytes reside in fluid because we're
concentration of hydrogen ion in the extracellular fluid is kept constant at 40 nanomoles per liter. Our bodies produce two types of acid, volatile acid and non-volatile acid. Volatile acid forms when carbon dioxide, produced by cellular respiration, combines with water and forms carbonic acid. Pulmonary alveolar ventilation eliminates carbon dioxide from our body and prevents the accumulation of roughly 15,000 millimoles of carbonic acid produced daily. Respiratory acidosis develops when alveolar ventilation is impaired and can be caused by disorders of the lung or a failure of ventilation from depression, respiratory center, or neuromuscular disease. In acute respiratory acidosis, an abrupt failure of ventilation causes the PCO2 to be elevated with an accompanying acidemia. In chronic respiratory acidosis, the PCO2 is elevated with a near normal pH, secondary to renal compensation and elevated serum bicarbonate levels. Acute respiratory alkalosis results from an acute increase in ventilation, secondary to disorders of the lung, or due to direct stimulation of the respiratory. Chronic respiratory alkalosis allows for renal compensation and decreased bicarb levels. Metabolism of proteins generates non-volatile acids, which are buffered by both intracellular and extracellular buffers, including bicarbonate.
Conclusion. In summary, the regulation of glucose homeostasis leads to many direct and indirect effects of